people, I hate to even call them patients, people talk to other people too besides us as healthcare providers. We hope that they get the most advice from us, but we also know that they go on the internet, they talk to their neighbors, they talk to their family members, and they will often say to us, my sister Susie took that medicine that you're recommending for me to take, and she had terrible side effects. I don't want to take that medicine. Then you have to talk about that. Well, what were Susie's side effects? And you have a different, you're different than your sister, and try and clarify really the purpose of the medication. And perhaps Susie didn't have the best understanding from her healthcare provider. So it's a process. Well, I actually love when other family members or friends are brought in, because it helps me to communicate the information I need to communicate to somebody that is not just the patient, somebody who is near and dear to them and who I know they are talking to. So they've heard it from me, as opposed to, the patient telling them what they think that that I've said. And I can then answer that individual's questions as well. And so I love when somebody brings somebody else in. Yes, it probably extends the visit a bit, and we're always crunched with time. But I think that I think that's the best of both worlds, because sometimes I'll leave my office, move on to other patients, and by the time I actually get to my computer to finish some, my charting and everything, I will have maybe a phone call from the patient with additional questions, or maybe it could be the patient's spouse asking questions because the patient came home and said, this is what I was recommended to do. So I love when I have that captive audience, in the office, so I can communicate the same information to everybody who needs to know. Well, I'm a nurse practitioner, so I have, I have the ability to assess, diagnose, and manage patients and prescribe medications, counsel on lifestyle interventions as well. So there's some overlap. There's definite overlap between what a physician does and what a nurse practitioner does. However, I like to think that, well, I'm a nurse first, and I have a very broad-based preparation, and that I'm very good at communicating with patients. And as you probably know, nursing is the most trusted profession. We have been for decades. The only year we weren't was the year of 9/11, and it was the first responders, of course, who are the most trusted profession. But year after year, nursing is ranked as the most trusted profession. So people do feel comfortable talking to us. And I think that I'm able to use that in my skills, my communication skills, to my advantage in helping patients reach the best decision for them. I think there are challenges. A lot of my patients a few of them have my cell phone number. A lot of them have my email address. And I do still respond to, I hope my organization isn't hearing this, because I still respond to emails. We have an electronic medical system that is commonly used across the country. It's called Epic. And there's a feature on Epic called MyChart, where you as the patient can log into your MyChart profile, and you can message your providers. And so I do get those messages from my patients, and I respond to those messages. And the organizations now prefer that if we're not directly talking by phone, that's how we're communicating with our patients. It's considered to be a bit more secure whereas even the best email system is not exactly secure. So I am careful about what I will communicate back to my patients via email if they do email me. I hate to just break off that, or turn them off by saying, no, you can't email me anymore, because we often communicated like that for a long time, and they've been long-time patients. But I may say, let me call you, if it's going to be too involved, or if I feel the need to communicate something that's a bit too private to put on email. So yeah, we have all these vehicles which take more time on the provider's part, certainly, but I think for the patient, which is the most important, it's a good thing. Hopefully it is just going to continue to get better. I think that the more we communicate with patients, the better they feel about the care that they're receiving. I want my patients to be able to say whatever they want to me, and for us to have an open communication. I think a good clinician or provider-patient relationship is absolutely key for improving outcomes of patients. Now we as providers are being judged not necessarily on how many patients we see a day, but on what outcomes our patients achieve. And if they're engaged in their own health care, and if they have a good open communication with their providers, their outcomes are going to be better. They're going to have better blood pressure control because they're going to be monitoring at home and then communicating when something isn't right to me. They're going to have a better cholesterol control. Hopefully they'll engage in the appropriate lifestyle modifications, changes to help improve their health, like a healthy diet, regular exercise, etc., because I talk to them about that.